Hello. Hi, Carla.
Hey,
Hello,
hey,
hello.
hey.
So today is the 21st of July, and it is almost 5:30 in the afternoon here in Germany, where I am at. And I am Laura Maria Caldarone, and this is 14 Days to Change. And with us, we have Carla Lotz, Project Resources Manager, all the way from Cape Town, South Africa. Hello again, Carla.
Hi, hi. It's
Hi.
nice to see you again.
It's very nice to see you again. So, well, as you obviously know, Carla, you are the 24th story in this series, but it's actually the second interview you and I have, because the first one we had was exactly 14 days ago on the 7th of July. And back then we spoke about how the situation was in South Africa on that day, what had been happening, and just we got to know you a little bit better, your story. Now, before we kick off this interview and really just see how things have changed, how the situation has changed in South Africa and also a little bit in the world, I'd like to show you bits and pieces of our conversation from 2 weeks ago, especially so we get to really see who you are and how it has been living the pandemic in South Africa. Before we do that, I just want to talk about numbers, because I think as we can see and we will talk about, unfortunately things have changed for South Africa, and they have not changed for the better in these last 14 days. And I think it's very important that while we see where you, Carla, were 14 days ago and what your thoughts were and what was happening and what so many other things, we see, we think of the numbers, because every number is a case, is a family that is worried and or is a family that is saying goodbye to their loved ones, right? Because we have total cases and we have deaths. On the 7th of July, so 14 days ago, South Africa had 215,855 cases. Back then, South Africa had just surpassed Germany, and we had spoken about it because I live in Germany, and it was a big deal.
Yeah.
Now, 21st of July, South Africa has 373,628 cases. Huge increase. And we can say you are up there with the people you don't want to be up there with. You are with the United States, you are with Brazil, you are with India, you are with Russia, and you actually surpassed Peru.
Yep.
Unfortunately, also, there are new deaths. On the 7th of July, you had 3,502 deaths. And today you have 5,173 deaths. We will talk obviously more about it, but now let's just think of those numbers, keep them in mind, and let's see what we discussed two weeks ago. So I'm gonna ask you to go on mute. And let me know with a thumbs up or something that you can see everything and hear everything, that everything is fine. So right now you should be able to see yourself and me of the past. And now you should hear. Let's kick this interview off. Carla, tell us about yourself.
Cool. So my name is Carla Lotz. I am based in Cape Town, South Africa. It's currently winter here, so I am dressed as warmly as I possibly can be. Don't be fooled by the sun. It is cold outside, and my washing did get wet. But anyway, so I lived in Cape Town my whole life. I grew up here. I live about 2 kilometers away from where I was born. And I really love the country that I live in. It provides me with like a whole range of activities that I get to do. I love going to the beach. I love going for walks in the mountain. We've got beautiful forests. But at the same time, we have a really great restaurant scene because I love food so much. Sushi, especially, it's a weakness of mine. But yeah, getting to just be super active in the city is beautiful. Going for runs along the promenade. If you haven't been, I highly recommend you come because
Yeah,
it's right next to the ocean.
I've
Stunning.
never been, and I really think if we were speaking in the past or in the future, you're basically promoting your country. Come to South
Yeah,
Africa.
come to South Africa, but don't come right now.
No, not
Highly recommend to not come to South Africa right now.
yeah, no.
But it's definitely the kind of place that suits me because I get to be outdoors a lot. I get to spend a lot of time with like nature and
Everything.
also eat really good food, which is very important to me.
But do you know how to cook?
I do. So I feel like my speciality is mac and cheese
Ah,
because I'm very specific with how mac and cheese needs to be like created. Some people prefer slightly more dry mac and cheese, where I'm all about the sauce. Like so, a super cheesy mac and cheese sauce. That's really my go-to.
so
Um,
could you say you've stolen it from the Americans or no?
I would like to say that I have borrowed it and improved it,
Ooh,
but
I like that.
um, others might disagree. But we also have something in South Africa called braais, also known as like barbecues around the world. So a big part of our culture is to like crack open a beer, you have a braai on a Saturday afternoon, you watch the rugby with all your mates, and it's just like, oh, it's the best in summer. That is what you do on a summer Saturday: braai, beer, sport.
It's I want that. So you're in winter, we're in summer, but I don't know if you can tell, but it's quite ugly outside. But I'm in Germany, so I mean the weather is not the best, especially where I am at. But yeah, summer barbecues, that sounds nice.
Yeah, it was really hard to like um end summer without having a lot of social braais because our summer ended as COVID started.
Yeah.
So being indoors for a lot of it, I'm very, very pasty. Can you tell?
And that is why. And aside from food and aside from being one of the best travel agents I've seen promoting South Africa, um, what about life-wise, job-wise? What is it that you do?
So I work in project management. I am what we call a project resources manager. Basically, my job is to make sure that work that comes into our company is allocated and distributed in a way that like aligns with people's careers. It doesn't overwork them. It doesn't underwork them. So there's like a whole lot of puzzle problem solving that I get to do on a daily basis, which I love because I love working with people. But I also really like my brain is always going like 1,000 miles an hour. And I love getting to put that into what I do every day, which has been really, really amazing. My company is an e-learning agency. So we've actually been really busy during COVID because, you know, everyone wants to get online,
Yeah.
which I'm super, super thankful for that. But yeah, work isn't the main part of my life. I would say spending time with, well, when I can with my family is really important. I'm married. I love my husband. He is my favorite person in the world. And so I've just been spending a lot of time with him, reading. I started painting. I'm not a good painter,
Not yet.
but not yet, but I've tried. Yeah, so when I'm not working, I'm trying to entertain myself I'm generally a busybody, but I love a good book. Yo,
That's
love
me.
reading.
That's
Yeah.
yeah, that is me. I don't know, because it's always so different, and And it depends on you, right? How good
Yeah.
your imagination is. So I guess people, but no, because if you like reading, you become good, right? Like you have to have a good imagination, and maybe you don't
Yeah.
start with it, but it you transform, right? So
Yeah.
it can never be bad. And if you don't like reading, that's because you haven't read the first good books, right? It hasn't hooked.
Exactly. Exactly. I am all about like fantasy novels. I read The Magician in like 2 months, that entire series, because I was just, okay, it's 3 books, but still like flew through it, because it's just, oh, nothing like a good book. Like good book, a glass of wine or like a cup of hot chocolate on the couch. I'm good.
You see, it's that's what it is. And tell me, does this mean, because you just mentioned, okay, reading, obviously it's something that you like doing before and you like doing now, and you will always like doing, because once you like reading, that's it, right? It's for
I
life.
can't stop. Yeah.
Can't stop. But what about, you mentioned painting. Is this something that you started doing now because of the coronavirus? So did you, let's say, my question is, did you have to reinvent yourself? So what did you do
Mhm.
before the pandemic and after the pandemic, and from a job-wise perspective, so at work, but also in your personal life? So is painting, did I get it right that painting is something that you started now?
Absolutely. I am not a very creative person in that I struggle to create new things or new things that are pleasing to the eye.
Mhm.
Um, but during our level 4 lockdown, they were selling like paint by numbers and a whole bunch of arts and crafts supplies. And so I was like, well, I'm kind of a little bit bored at home, need some more variety in my life. So I was like, cool, let me just buy this. Started it. I really, really enjoyed. I did buy a paint by numbers, and even then, I'm like struggling. Um, but I started this paint by numbers for grown-ups. It's a grown-ups paint by numbers. So there's very, very small little spaces to paint, because I was like, well, what I usually do, I can't do. And what I usually do is go to the gym, visit my friends, see family. I love eating out at restaurants. I love getting out. Just before we went into our level 5 lockdown, the last thing my husband and I did was a walk in the forest, because we just love getting out, and being outside. And that has been really, really tough for me, because I've had to have this huge mental shift from going, oh, you're now not allowed to leave your house. So when our government first implemented a lockdown, it was what we now call level 5 lockdown, where you were not allowed to leave your house. For 35 days, you were not allowed to leave your house. And for someone who is social, likes getting out, that hit hard. I was not ready for that.
My question is, what is happening right now in your country? What is the most important thing, topic, news that people are talking about, people are watching, people are concerned about? Is it still this that you just told us about, the fact that you have so many that are immune compromised
Mm.
and can be obviously even more affected by the coronavirus,
Mm.
and what to do? Or is there more? Or just tell me a little bit about that.
So the two that like spring to mind are our no smoking. We have a cigarette ban currently, and the fact that our schools, casinos, restaurants, movie cinemas, they've all opened up recently. So what I've personally found is that I've struggled to understand the logic behind the decisions our government is making. Especially like we've implemented a no cigarette ban. So no grocery store is allowed to sell cigarettes. When we started our level 5 lockdown, I think we started that at the end of March, that was no cigarettes and no alcohol. From level 3, level 4, I'm not even sure. They all kind of merge. you were allowed to buy
Which
alcohol.
alcohol I can understand, because we can see it right now, even in some countries, like in the United
Yeah,
States, you have already some states, like if I'm not mistaken, Florida, that are saying no alcohol in certain places at a certain times,
yeah,
because it doesn't help the situation, right? Like,
mm,
but
yeah,
um, doing it in March, yes, it's more cautious, I guess. But the
yeah.
cigarettes, that's a little bit
It's weird. Like,
weird.
and I'm not a smoker, but I don't understand. I don't understand it. I think that there are some slightly sneaky, politically motivated mechanisms going on in the background that have contributed to the cigarette ban. But essentially, people who have been smokers their whole life have not been allowed to legally buy cigarettes since the 26th of March. So where are we now? The 7th of July. That is March. I don't even know. That's many months. That's 102 days.
For a smoker,
And for a
because I used
smoker.
to be one, half a day is a long time. So imagine months. It's
Yeah, it's hectic. And let's not kid ourselves. People are still buying cigarettes. Like every smoker that I know has bought some off-brand cigarette that
it's an
is filled with, I
addiction.
don't
You
even
can't,
know what.
yeah, it's an addiction. You can't just, quit your addiction. That's why it's so difficult to quit smoking, right? It's
Yeah,
hooks
it,
you.
it's it's absolute like it's absolutely ridiculous taking away someone's right to choose in a sense. And like the reasons behind them I feel have been really bad, like, oh, smoking is social, so you're gonna take a puff from your cigarette and pass it on to someone else. No,
You
like
do that
people
when
aren't
you're
dumb.
13, 14, and you're starting to
Exactly.
smoke when you shouldn't be smoking. But
Yeah,
yeah, no smoking. I mean, in general, we know smoking is not good. It's not
yeah,
healthy. So in a way, if you have been able to quit smoking because of the ban, that's
yeah.
excellent.
Congrats. That's
Congrats.
fantastic.
And do not, take back the habit.
Yeah.
But it is it is difficult to be banned from
Yeah.
one day to another. An addiction just stopped,
Yeah.
and without, like you said, the reasons, that there's no logic. It hasn't been
Yeah.
explained. Maybe there's a logic, but it hasn't been explained, so it adds to the confusion, right? It adds to the,
Yeah.
wait a second, what's going on here?
Exactly. It kind of it diminishes the trust. When we started with our level 5 lockdown, we were like, we're trusting the government to make the right decision for us. And the whole country had bought in. And like for a country to buy in to not leaving their home for a month is huge. But then with each decision that they made that didn't add up, that's when you start to erode the trust. And people are buying smokes. Well, I don't even know how they're getting them, but I know that they are. There was alcohol sales happening during level 5. Like, you can't stop people because just by policing them into a state of fear. So yeah, that the no smoking ban is just super, super strange to me. I don't understand it. I don't support
And
it, and
it
I
is
don't
still
support
banned.
smoking.
It is still
Yeah,
banned.
yeah, and we have no idea when cigarettes are going to come back on
Mhm.
sale.
When
People
and
are paying 5, 6 times the price they normally would for a pack of cigarettes because it's an addiction. And yeah, I mean, I realize that it sounds like I'm very pro smoking, and
it does a little bit. Come to
I just
South
want
Africa and bring cigarettes.
please bring. But for me, what frustrates me about the no cigarette ban is that we've almost taken the population and said, no, you're too childish to make these decisions. We're going to make them for you. And that's what upsets me. And I also recognize that being an addict, like, addiction exists and we need to help people treat their addictions. I don't believe that taking something away categorically is the right thing to do. And so my frustration with the cigarette ban is just like, give people the right to choose, and they have to be the ones to choose. So yeah, that doesn't make much sense to me at all. And then the other thing that's in our headlines at the moment is how our schools are opening. The school, I know of 2 schools in the neighborhood that opened. They were open for 2 weeks and had to be closed for 7 days because they had so many positive cases. So when we first went into lockdown, our first term ended and we went into school holidays. We're now halfway through our academic year, and I can understand why government wants teaching to commence, especially because we have so many members of our population who don't have access to smartphones, to tablets, to Wi-Fi, and can't get digital learning.
Which is another reality, what we were discussing before. It really depends on the reality of the country that you start off, right?
Yeah. So that's really big in the news. I have friends who are teachers, and they're like, they have to teach in a mask all day, because one of our laws now is you have to wear a mask if you leave your house. You're not allowed into a grocery store if you don't have a mask on. So we have teachers and kids who are in masks all day trying to maintain, the 1.5 meter distance, and it's just not working. And yet we've opened up our casinos, we've opened up our restaurants, we've opened up movie cinemas.
They're already opened.
Yeah. So our casino, we have like one big casino in Cape Town. I think that opened over the weekend or end of last week.
So
and
right
restaurants,
now, recently. Okay.
Like in like a couple of days ago. Restaurants are kind of taking a more phased approach. I won't be visiting any restaurants to sit down for the next while.
Yeah.
But yeah, it doesn't make a lot of sense if you want to protect your people, that you're opening all of these things up, but at the same time if you need your economy to run and to operate, you need money going in and out.
It's very difficult.
I'm really glad that
then so many countries are seeing the pros and cons, choosing their pros, and then realizing that there were more cons, and it's very unfortunate. But especially thinking about what we spoke a little bit ago, that you were telling me, just as a fact, South Africa is a country with a lot of immunocompromised people, right? You said tuberculosis, you said HIV, and I can understand how the concern now with all these things that are opening up, with your numbers already going up. Yesterday, you had almost 9,000 cases in one day. Your total cases have surpassed Germany. And Germany has been doing very well. It's thankfully one of the countries that has been doing well from the beginning, but we have a big number, not as big as some, obviously, but the fact that I personally have not seen South Africa's number, and then, suddenly, quietly, you kept on increasing until bang, above.
Surprise.
Yeah, that's a lot. So concerning.
It is. It really, really is. And it's frightening. I think South Africa is getting COVID a little bit later because we're moving into our flu and like cold season now. We're going into winter. Well, we're in winter. Things are cold. This is when germs spread. So I think exactly. So if we're sitting at 9,000 cases a day in June, I don't even want to know what it's going to look like in July and August. July is typically our wettest season, and August is typically the coldest season, apparently, according to my husband. That
says.
That's really frightening. I don't think that the next 4 or 5 weeks, I don't think until mid-August we're going to feel safe to be outside.
Especially, yeah. I mean, it's the weather, which unfortunately at the beginning of the narrative of the what's happening, what's not happening with the virus, sometime around March, February, even very recently, last week, 2 weeks ago, whatever it is, one of the things that were heard from different people in different parts of the world was come the warm weather, the virus will disappear or will just be less, not as strong. It'll be weaker. Unfortunately, that is not true, because even months ago, when it was our winter, so Europe's winter, you had tragedies happening in Ecuador, for instance, where it was summer.
Yeah.
And we are seeing more and more studies, more evidence, more examples that warm weather, it's not that it's going to help. If anything, it's just normal. And then if it gets worse, it will be in winter, because not necessarily because of the weather, but mostly because of the other problems that the weather gives you. So the normal, usual flu, influenza that you have every year.
Exactly. Yeah. Yeah, so it's going to be rough. I'm very aware that I think we're about to go into very dark divisions with the coronavirus. I think our numbers are going to get very scary. And like, that's really frightening. I'm really not looking forward to July, because I can't see how it's going to be a great month.
No.
And I mean, I saw on social media and a little bit in our local news, like, are we going to go back to a more strict lockdown? Because it's clearly not working. But at the same time, we need our economy to be making money, because we don't like, South Africa's not, rolling in the cash on a good day. So I do not envy our government right now. I don't agree with some of the decisions they make, but I also recognize, like, if I was in their position, I would not be sleeping. I would probably have stopped eating, because to navigate this situation is hectic.
It's difficult. It's very difficult, no matter what country you're from, and no matter what type of government you are, right? Because we know, history knows, that some governments in some countries are better than others. That's how it is. That's how it is. So, but now it doesn't really matter how good of a government you were, or how bad of a government you were in the past. Right now, you need to be a good government for your people, for your country. And unfortunately, good is very difficult. It's very, very difficult in general, but now it's even more. What are your hopes? What are your concerns? What is it, with the knowledge of what's been happening, what's happening currently in South Africa, but also, around the world? What is it that you're afraid of, that you're concerned about? What is it that you hope happens? What is it that you want to happen or not want to happen in the next few days, in the next few weeks?
I'm going to start with my concerns so we can end on a happy note.
Sounds good.
So I am worried that people are going to get tired of the coronavirus, get tired of what it means to be safe in a corona environment in this time, and I'm concerned that they're going to become a lot more relaxed. Now, especially in my country, is not the time to become more relaxed, to go out, to socialize with people. And I'm really, really worried that people are tired of being indoors. And I get it, I'm tired too, but now is not the time to be tired. Now is the time to reignite that fear or energy that we had around coronavirus when it was March, and to really start to, like, look internally and put ourselves under a hard lockdown. And I'm worried that people aren't going to do that. People are going to stop taking it seriously. They're going to get tired of it and start behaving recklessly. But I know the people in my life. I know the people in their lives. And I do think, and this is my hope, I hope that the people that I know that I can influence and that they can influence start to be extra careful with coronavirus. I hope that in a few weeks' time, everyone in this country is not leaving their house because they've seen the numbers climb, and they know that by staying indoors, those numbers will drop. And so for my hope for the next week, for the next 2 weeks, for the next month is the same thing, is that people keep taking it seriously. They keep doing everything that they can to help others and to prevent the coronavirus spread within South Africa. And kind of like a sidebar to that hope is that I hope at the end of all of this, we all come out better, more caring people. I for myself personally, I don't want 2020 to end and for me to come out the other side and say, oh, well, I didn't really grow that much. This is one of the best opportunities that I'm going to ever have in my lifetime to show that I care about others. And I hope that with every day that passes, I'm doing that, I'm implementing that, I'm making it happen.
Very positive and inspirational.
Oh, thank you.
Very, 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 very good. And true. And yes, it is hopeful, but it's a hope that can become a reality. And we have seen bits and pieces of good stories here and there, things that have changed other people's life, right? And like you said, we can do more and we can have more.
Yeah.
And it does sound cheesy, you know, it does sound cheesy, and it is cheesy, but but it's cheesy because it's good, especially for someone that likes mac and cheese like you, and like,
that's me.
you know, and I love cheese. I like cheese too, love cheese too, and cheesy is not bad. And in this case, cheesy, it's got to be cheesy. You've got to.
It has to be. You've got to cheese. You just get all of that cheese up in there.
Yeah, and do some good whenever you can, wherever you can, because what comes around goes around. It really is like that. And unfortunately, in the pandemic, a lot of it is not just because a lot of people say, you know, Darwinism, but it's wrong. It was wrong in March and it's wrong in July, because that's not true.
Yeah.
Darwinism means survival of the fittest.
Yeah.
And that's not the case here, because the people that think are fit are the ones that are doing damages, or some of the ones that are doing damages, but the ones that are suffering are not necessarily the fit ones, are not necessarily the ones that are doing the damages, but are the ones that come into contact with them. And that's why this is not a moment to think of only yourself, because unfortunately it can even be bad for you, because you can be 26 or 36 and be immunocompromised and not know. It's not that every person that has a comorbidity knows about it.
Yeah,
you know,
absolutely. No, I mean, not to sound incredibly bleak, but no one's safe.
It's the reality, right? We already spoke about hopes and inspirational moments and just everything that one dreams of and so on, and that's great, that's good, but you have to be realistic. This is not a moment that you can just close your eyes and wish it away, because if that was the case, then That'd be so easy. No, we would all have
But
like, just wish it
yeah,
away.
yeah.
Carla, we spoke about everything, and I still have a lot to talk about. And now you were inspirational in your message. You were a little bit bleak also, but that was my fault because I pushed you towards it. But we did speak a lot about other people, right? About
Yeah.
what you can do for others, and how what you do affects others, and what you want for others, right?
Yeah.
And now I want to bring it back to you. So be selfish.
Okay.
Bring it back to you, and let's end it on this note. I want to know if you could speak to the Carla that will be here in 14 days. So your future self, and you could give her a message. What would you tell her?
I would tell her to stop stressing so much about life. Yes, coronavirus is big and it is scary, but there are things that are very much in her control that she can do to make it less scary for her and less scary for others. So the first thing I would say to me is, Carla, just stop stressing. Whatever you're stressing about right now, just stop it. It'll be fine. And the other thing is that I hope that in 14 days, you've done something that's made this world a better place. And that's a challenge that I'm going to put to myself. In 14 days, in 2 weeks' time, what have I done to make this planet better? It can be for one person, it can be for 100 people. But in 14 days, I want to have done something. And I hope that the Carla that I see in 2 weeks' time has done something. So yeah, don't stress and do something.
Perfect. Don't stress and do something. And it's better if you're doing something without stressing.
Exactly. That's like the goal.
That's the goal. And like you said, it doesn't matter one person, 100 people, just make a change. Because if this pandemic has taught us anything, which it has taught us so many things, but one thing that is true, that is good and bad, sad and an opportunity, is the fact that you can change it. And doesn't matter, it's never too late. It's good because that means that whatever your situation, your country's situation, your city's situation is in, even if it's really bad, it's never too late. You can make a change. Just forget about yesterday. Start making the change today. Start wearing the mask. Start social distancing. Start, if you're able to, just stay home. Start doing all these things that we now know help prevent the spread.
Exactly.
And also, if you're in a country that is doing well, don't get too complacent. Don't forget that it takes a moment. It takes one person, one situation, blink of an eye for things to go wrong. And you don't want that to happen, because all your effort, everything you've done will be for nothing. So change can happen. And we've seen 14 days is when you start seeing the change. So just like you gave a message to the future Carla, don't stress and do something. Let's see how that goes. Because as you know, you and I will speak in 14 days.
I'm looking forward to it.
Thank you very much. And I will
Thank
see you
you.
in 14 days.
Yeah, I look forward to it. Thank you so much for having me.
Thank you. Bye, Carla.
Bye.
Carla, you may unmute yourself and let's
There it is.
talk. So,
Hello.
hello. This is the first time, obviously, that you see some of the things we spoke about. And how does it feel?
It's very weird watching myself. It was really interesting, and it was so nice to hear our previous conversation and to like reflect on that and to have something like that to look back on and go, oh, right, that was what reality looked like 2 weeks ago. So it's really cool. But I don't like hearing myself being recorded. I don't like that sound.
Oh, no? Well, I have to say, you are, I don't know if I can say it, but you're one of my favorites. You are. I laughed a lot with you. Like, we laughed a lot
We did.
in our conversation, even when we were talking about things that were a little bit more sensitive, more sad. We took comfort, I think, unconscious comfort, right, in laughing.
Yeah.
And also the other reason, which I did mention last time, is because so much of what you were telling me about South Africa was completely new to me. South Africa is not really a country that I knew a lot about before the pandemic. I knew a little bit of the history, because you have to know a little bit of South Africa's history, and here and there a couple of things, right? But even with the pandemic came the realization that I still didn't really know much about it. Like we spoke last time, it's because South Africa wasn't really a country we spoken about. And then, well, we have other countries that are doing really poorly, unfortunately, and they have been in the spotlight, right? But now, like we were mentioning 2 weeks ago, now I hear and I read more about South Africa.
Oh, interesting. That sucks, but that's also good.
Yeah.
But oh, damn.
Yeah.
Yeah.
The reason why is, I mean, we said it in the numbers, right? That is a humongous increase in, I don't know. It's really big. It's really big. And you already hinted at it, though. 2 weeks ago, you were thinking and saying July is not going to be a good month. And
no, yeah. So we on the 11th of July, our president addressed the nation and effectively said, like, our scientists have worked out that we're going to hit our peak from July to September. So some provinces are ahead in that they got COVID earlier and are kind of working through the system a bit quicker than other provinces. But yeah, I mean, we're going to hit our peak between now and September. That's still 3 months. And so in his address, he declared that the national state of disaster would continue. And he banned alcohol again. So we're now no longer allowed to buy alcohol. And he's reinstated a curfew. So between the hours of 9 p.m. and 4 a.m., you aren't allowed to leave your house again. So we've effectively gone back a level where you're no longer allowed to purchase alcohol. You can't leave your house after 9 p.m. But our restaurants, casinos, schools, they're all still open. But I mean, who's going to visit a restaurant if you can't have a drink? Well, I mean, you can visit a restaurant and just eat, but then you have to make sure that you leave in time to get home by 9 o'clock. Like,
and it also doesn't. So what? The virus is not at the casino. Like, it doesn't like to play poker, but it's you going around the city, so you have to stay home.
Yeah. Yep. Oh, and you're not allowed to visit your family. So I can still have dinner with my family in a public place, but I'm not allowed to drive to their house to visit them. Which I don't understand.
It's I don't know. It reminds me of something that you said last time, how you basically trusted the government, right? To buy into what they were saying. And then as time went on and certain things were done or said that didn't make sense, and it's not that they didn't make sense because you don't understand or you don't know, it's because things are not transparent, they're not clear, they're not explained. And we have already seen that that's what is needed, right? A relationship of trust, of communication between those in the authorities, so the government and the citizens. So to do this that you're telling me of, you can go with your grandparents and your parents and your kids to a restaurant, but you can't go visit, it just doesn't make sense. Or that you tell me between this time and this time you have to be home, but hey, want to go play poker, let's go.
Yeah, that's, I think, the like my biggest issue with it is it doesn't make sense. Like, I do understand the no alcohol, I understand that ban, and I can accept that. I have friends who work in healthcare who their ER started filling up with alcohol related incidences. So I do understand the need for that, and I can even understand why there's a need for a curfew if you're living in an area where you're in close proximity with other people. But like the fact that I can't go visit my parents, but I can see them in a place that endangers my health, their health, and the people around me, that doesn't make any sense. Where if I could just know I can visit my parents and my mother-in-law, and they're allowed to visit me, and she's allowed to visit us, then we have a little bubble. We know who's in contact with who, but I can't do that, and that just, it boggles my mind. It makes no sense.
And I assume, and from our conversation last time, and just a very obvious assumption here, it might boggle your mind, and you might be a little bit annoyed about it and just frustrated. But at the same time, you will be careful, and you are careful, so you don't go to the restaurant and you are actually thinking twice of visiting your mom. But you're one of the few, because not everybody's going to think that way, because they're going to be like, but wait, if I can eat with them at XYZ restaurant, then whatever, mom can cook mac and cheese that I love, right? And so I just go and won't tell anybody. And or just say, but wait, how is it okay for this but not okay for this? So then should all be okay? It just adds to the confusion, and it makes it worse. And that's not what you need. I mean, you just mentioned you have friends that work in the healthcare system, and last time you spoke about I believe it was your best friend or a good friend of yours, that you were, that was also one of the moments that you realized when that this pandemic was something serious, when you started thinking, okay, this person that I, love and care about, she's gonna be working in a COVID-19 ward. So all the patients in there have this unknown virus, and it's scary, right?
Yeah.
We had our interview 2 weeks ago, and a week or so later, the Daily Maverick, so an online paper of yours, news outlet of yours, and BBC, they reported that Eastern Cape's healthcare system was basically a step away from collapse, for different reasons, mainly because staff shortages everywhere in the world, nurses and doctors, it's what's missing and what we need the most right now. Just strikes, because all the strikes right now, from the healthcare system perspective, they're basically the same reason. Not enough protective gear, not enough money for the things that they did before the pandemic and what they're doing in the pandemic. Fear, no communication. So the strikes, whether they're in South Africa or in the UK or in Brussels or in South America, same reasons, right?
Yeah.
But then you also have old issues. You have issues that were there already from like poor management before the pandemic. So obviously it makes it worse. Can you tell us a little bit more? Like, what is your friend saying? How much has it changed since this news was reported around the 15th or so?
So yeah, it's just the, trying to not be super depressing. But yeah, it's very real. Our hospitals have turned entire wards that were orthopedic wards or chemotherapy wards into COVID wards because we just have that many patients. Yeah, no, it's tough. And each province is managed slightly differently. So where I'm from in the Western Cape, we have a different political party managing this province to the one in the Eastern Cape. But at the end of the day, like, we were never equipped for COVID. We were never going to be able to equip ourselves enough for COVID. And the reality is that you have 100 patients sitting in your emergency room waiting to be diagnosed. And I mean, 100 people in one place, you can try and social distance as much as possible. You're wearing your cloth mask, but you know, there is still a chance that you could just get infected by sitting next to someone. I was driving to the shops the other day and I had to drive past a hospital. And there was like it was one of the hospitals that does our COVID tests. And there are chairs that are 1.5 meters apart outside. And people with symptoms or people without symptoms, people suffering from COVID or not, have to wait in this line. And, you know, like, they're doing the best they can. They are working so hard. But it's just, we're dealing with something that's bigger than ourselves. And our numbers are climbing. The deaths, we have new deaths every day. And I just really, really hope that we start to see a decrease soon, because I don't know what's going to happen in 2 weeks' time or a month's time. When, like, what happens if our hospitals burst their banks? Like, it's frightening. And more I'm hearing about there not being enough beds. We're running out of ventilators. We're running out of PPE. Like, I know of people who, you know, they get 2 masks a day. They keep one in case that we run out of PPE.
So just use that one and
yeah, and like store one in case that there won't be enough. So like, I have a lot of respect for healthcare workers who are putting their lives on the line, as well as our teachers and us essential worker, everyone actually who's facing COVID daily. So much respect for them.
Especially because most of them, unfortunately, cannot self-isolate, or so they work at hospitals or at schools or wherever else they are essentially needed, right? Because these are the people that a community, just life needs, as we can see. Like, for instance, other people can stay at home. They are needed, but they're not needed outside, right?
Yeah.
And they go back home, right? They go back to their kids, to their partners, to their family. And so you have, it's really, you're right. It's thanking them. But, you know, one thing that they did in the UK, I don't know if they did that in South Africa, but in London, every Thursday for I don't know how long, you had Boris Johnson, Prime Minister Boris Johnson, outside of his like door and clapping, you know, clapping for NHS, for the healthcare workers and everything. And it is a nice gesture. You should clap, you should be thankful, but once, twice, or you can even do it every day, every second. That's fine. But it cannot be the only thing you do. Like, keep your claps, because if you're not giving me the protective gear, the masks I need, the visors I need, the gloves I need, if you're not paying me what you owed me before the pandemic and what you should be giving me now because of everything else that I'm doing, or if you're clapping tonight, but then tomorrow you have a party in your house and invite 5, 6, 7 other households, keep your claps.
Yeah. Yep. Clapping is great. Thanking them is great, but you can thank healthcare workers with your actions too. And those actions, I think, speak louder than making a noise at 8 o'clock. Yeah. Also, great idea. Love it, but it has to go further than just standing outside your gate and clapping.
Exactly. And obviously this is not directly directed only to the Prime Minister, Boris Johnson, because like him, there are others. It's not only him, it's not only the UK or England, and it's not only governors and governments and presidents and prime ministers, right? It's us, it's the citizens, and every action, like we've repeated, is, you know, I told you, your video, I tried to edit it as shortly, like to make it as short as possible, because there was so much of it in our first interview, and really you'll see all of it was good. I really wanted to put it because they all had bits and pieces of messages that need to be heard, not only for South Africans, but for Africans and for anybody else, anywhere else, right? And one of the things you spoke about was about your sister, and how the thought that, you know, your dad still goes to work, and your dad is the main provider in your family, and just the thought that because he has to go earn a living for your sister to eat and live, because of somebody else's action, he could infect her, right? Hurt her. And she cannot go out because she's immunocompromised. So she's one of the people that needs to be really taken care of. And your sister is not 93.
No, she's 15.
Exactly.
Yep. Yeah, no, and that's still something that I think about. Like, my dad has to go to work. He can't not. He is very, very fortunate that he can work from home for 3 days, but there's still 2 days that he has to go into the office. His office had a COVID case. Fortunately for my dad, he worked far enough away from the person to not have been exposed, but I mean, it was right there in the same building that he has to be at. And that's the thing, it's so inescapable, but there are things that we can do to make it safer for those who can't avoid going out.
And the other thing is, just with this example of your sister is 15. 15, life hasn't even started yet.
No.
And she's at risk. I mean, everybody is at risk, but it's a bigger risk. It will hurt her more, most probably, unfortunately, if she gets infected. So the mentality of saying it is my freedom, it is me, and anyways, it's only the old, and excuse me, who are you to say it's only the old, and what is old to you? Because unfortunately, as we've seen, and there's more and more studies that show it, yes, it is true that under a certain age, people suffer less. But first of all, define suffering, right? Because you can have mild symptoms, but you lose your sense of smell. Do you know what not smelling means? It means it's touching your brain. It means that you can't smell the delicious cooking that your wife or your husband or your partner is making for your anniversary. It means it's related with taste, I think, also, isn't it?
Yeah, I believe it's loss of taste and smell.
Yeah, exactly.
Yeah.
And not only that, but we don't know what's going to happen in 5 weeks, in 5 months, 5 years, 50 years. And studies are showing that people that recuperate, we knew this already, but now we have more studies, more people that recuperate. So technically they were infected, they had the disease, they had a mild symptom, maybe even loss of smell, and that is it, or fatigue. And now technically they're fine. The tests show they're fine, but they're still tired. They still can't smell. They still have scarring in their lungs. And we don't know if what is going to happen later on.
Yeah, we don't know what this looks like in 25, 50 years time.
Yeah, or
and
even
that's also
here,
really, really frightening.
Exactly. And these people are still older than you. So you're 26. The studies, the people, they're showing it's between 30 and 60. That's a huge category, 30 and 60. So it's not, I mean, sure, I guess I'm old if 30 and 6, like I can be old, right? Masks. We spoke last time about masks, about how you cannot go out of your house without a mask, right? And funnily enough, in this time that has gone by, in Germany, you have to wear a mask to go to a store, to a supermarket. So any indoor place, you'd have to wear a mask. You cannot go in without a mask. But out and about, you don't have to wear a mask. In the time that we have not spoken, there's more and more people here in Germany that are saying, enough with the virus, enough with social distancing, enough with mask wearing. Let it, like, we don't need that. We don't want that. Everything's fine. Thankfully, we have our Minister of Health and we have Merkel that are saying, yeah, dream on. The virus is still here. We're going to be careful. Of course, I'm paraphrasing. She did not say dream on, but in my mind, she did. So we're fortunate that we have this chancellor and this Minister of Health, but other places are not as fortunate. And then you have the people, right, that are still thinking, this is why I'm like circling to masks, because it's the same people that don't want to wear the masks. It's the same people that are thinking, oh, it's only the old, it's only the sick. But sick even means overweight. In this
or
case,
underweight.
Underweight in this case, like with the pandemic. So you're more at risk, and there's a lot of overweight and underweight people. Like very few have the perfect weight, if that even exists. So, and then you've got diabetes, and then you've got like 1,000 other things. So why aren't you wearing a mask? Not you, Carla. Like what are they saying in South Africa? Like, do you watch, for instance, the United States, that you have these people that are saying no masks, it's my freedom?
Yes, it blows my mind. Like, wearing a mask is really simple. Yes, in the beginning it was super uncomfortable. I did not like it, but I went grocery shopping on Saturday. I was at the shops for about an hour, and when I got home, I had forgotten that I had my mask on because I'm so used to it by now. And like, the fact that people are not willing to just cover their face, it doesn't restrict your breathing. I struggle breathing. I'm an asthmatic. Like, I can still wear a mask. It's great. It teaches you to be more mindful of your breathing. We could all be more mindful of our breathing. Yes, it's inconvenient, but every grocery store, every store, shopping center, petrol station, wherever you go, you are expected to wear a mask, and you are denied entry to that place if you don't have a mask on. It's just become something that we've accepted. I can now buy masks at any supermarket. There are about 1,000 small businesses in my area that also create masks. They're super accessible. they're affordable, and our government has said if you don't have a mask, a t-shirt or a scarf will work, but cover your face. So from my perspective, it's been well accepted in South Africa. I haven't seen the same resistance that I've seen in other countries, which I'm very thankful for.
Very, very thankful, because at least you don't have that problem, because it is a problem. This stubborn ignorance harms. It does, because how are you not understanding why a mask works? There are studies already. There were studies before the pandemic, now with the pandemic, and also examples. Look at the countries that do wear it, where they wear it, when they wear it, why they wear it. Even before the pandemic, Asia, you were sick with the actual flu and you had to go out, you wore a mask so you wouldn't give the flu to somebody else. And now it's because we know one of the ways that the virus transmits, this specific virus of this pandemic, is through droplets, right? And what are droplets? It's the little wet particles, the water, the stuff that comes out of your nose and mouth that you don't see, or you might see or not see. But right now, even when I'm talking, there's stuff coming out of my mouth and my nose that you can't see and I can't see, thankfully. But it's there, right? And if you know that this is the thing that is carrying the disease, if I have it, to you, to somebody else, why are you not wearing a mask?
I saw a really interesting example, like to explain and demonstrate the droplets, in that, like, when it's cold outside and you exhale and you can see your breath, that is the potential of how the virus could spread, because those are all technically droplets. And that for me was like, oh, I get that. That makes sense. We all used to pretend when we were young we go outside and exactly.
Yeah. And that's exactly it. It's difficult, especially now, seeing and reading. While I was preparing for our interview, I was just checking up what was happening, and actually, destiny-wise, coincidence-wise, yesterday, so, every week there's a number of daily briefings from the World Health Organization, and they've been doing it since January, and it's all COVID-19 related, pandemic related, and there's like journalists from every news outlet you can think of, and they discuss everything. And yesterday, one of the questions that was asked was about South Africa. And so I paid a lot of attention to it, because it was quite sad. It's the question was basically, what's happening? Why are we doing so badly? Why are things going so badly for South Africa, considering that South Africa was one of, or the strictest in Africa, with the lockdown and everything? And the answer was basically what we already knew from the beginning, that lockdowns it's a pause that you're doing, right? You're basically telling the virus, wait a second, let me prepare. Let me make sure I've got enough testing. Let me make sure I've got a contact tracing system. Let me make sure I'm like providing the protective gear to my healthcare people. Make sure the hospital there's enough resources, there's beds and everything. But once you press play, once you start opening the casinos and the schools and everything else, you can't just, be like, yeah, let's see where this goes. There must have been testing and other things behind the scenes while there was the lockdown. And when you open, it must really ramp up, right?
Yeah.
Obviously, it wasn't said that way, but that I'm like paraphrasing, right? And that was basically the message. And Again, it's never too late. So not South Africa shouldn't think, well, we're getting 500 cases every hour. That's what you're getting, 500 cases every hour. You've basically reached also 12,000 cases, 13,000 in one day. So don't think that because you're doing this is your reality right now, that things cannot change. We saw with your story 14 days ago, you were living a different reality. Still not the prettiest, but it was different than today, right?
Yeah.
And another thing that was said, which I think is good for South Africa to hear, so for it to be in your story, but at the same time for any other African country to hear, is that two things. First of all, don't think you're the only one in Africa. It's not really making it better, but at least you're not alone, right? Yes, the virus is accelerating in South Africa very, very fast, and that is worrisome, but you're not the only country. There are other countries in Africa that are also accelerating at the same pace. The only thing is that your numbers are much greater. They were already bigger, and that's why it looks like more. So that's the first thing. The second thing is, basically, you are a warning. South Africa is a warning to the rest of Africa of saying, if you don't wake up and if you don't stand up and stay at home if you can, when you can, if you don't wear a mask hygienically, correctly, as much as possible when needed, if you just don't social distance, if you don't help each other also, right? Think of each other, then things are get worse. So urgent action is needed for South Africa, but for the other African countries to look at you. You have half of the cases of Africa.
Oh, wow. I did not know that.
Yeah.
Wow. And Africa's a big continent.
Yeah.
It's huge.
It's huge, and it also doesn't have everything that some other countries or other continents have, and that's why you have to think of each other. But one thing that it does have is the knowledge that you can persevere and you can overcome things that first world countries cannot do or didn't do. Ebola, you guys in Africa, it was contact tracing. It was really knowing who went where, with who, when, and keeping track of it. And you eradicated it, right? So you can do it, even if your healthcare system is not doing well. You can make changes.
Yeah, it's never too late to make a change, and it doesn't even have to be a huge life change. It can be as simple as wearing a mask and buying your groceries every second week instead of every week. Some people aren't fortunate enough to be able to do that, but I am. I don't need to be in the grocery store every week, so why am I? Well, I wasn't, but let's pretend I was. Why would I be? So yeah, I mean, it sucks that our country is not the beacon, but you never want to be the case study, but I hope that other countries take what they've learned from us and apply our learnings and keep their citizens safe. Maybe it's a little bit too late for us. Our cases are still going to rise, but there are countries that with really, really swift action can avoid 5,000 deaths. They can avoid 1,000 deaths. So I hope that they learn.
Yeah. But it's never too late, really, and it's not only me saying it, but even the extreme experts, regardless what your opinion is on the World Health Organization, they are the experts in a global health crisis. And they've been saying it from the beginning. It's never too late. And
Mm.
I from the beginning, I completely agreed, because you can change. And contact tracing, even if you have 12,000 cases a day, start doing more today. And this is something your government needs to do. So if you have a voice, or if whoever watches this has a voice, you know, shake the government and say, hey, it's for you, for us, and for everybody, like the song goes.
Yeah.
Right?
Yeah.
It's really, really, really like that.
Yeah.
Look, tell me, what were you gonna say? No?
No, it's fine. I've completely forgotten it. Wasn't worth it.
Well, wasn't worth it? I'm sure that's not the case. I just interrupted you. But do you have anything else to say before I do the last question? I'm not cutting you off or anything.
Yeah, I think it's easy to take your foot off the accelerator. It's easy to go, I'm tired of COVID. It's easy to not wash your hands every time you come into contact with something other than your house. But that's not what we should be doing now. We shouldn't be taking the easy way out, because my misstep in something that I can control, something as simple as sanitizing my hands when I walk into a grocery store, could mean the difference between someone getting coronavirus and not. And now we need to be vigilant. Like I've been hearing about COVID since February, March. Like, I'm tired of hearing about it, but it doesn't make it go away. So to anyone who is watching, you're probably feeling COVID fatigue, but don't stop. Start doing better if you need to. Start wearing your mask. Start staying at home more. It is just that simple. If everyone did a little bit more, we would be in a lot better of a position. So do it. And it's not hard. Like, I mean, every grocery store gives us hand sanitizer. Like, it's not hard. Just do it.
Yeah, and again, it's not too late, and it's really just do you want more deaths or more suffering? You know, like, where do you want to be? It's really just change it and make sure it's less instead of more, right?
Yep.
So our conversation today wasn't as funny, as nice as, you know, as last time. Things got a little bit more serious, but you always need to be serious even when you are laughing, which that's how we spoke last time, right? But today it's a little bit more different, because things just didn't get better. Not only South Africa, right? There's a lot of other countries, and in the world in general, we're approaching 15 million cases. We've already like surpassed those 600,000 deaths threshold. And globally, the pandemic is accelerating, even if some countries are doing okay. And again, pandemic is global. Until it's nowhere, it's everyone's problem. So with that in mind, that things got a little bit more serious, and just your whole experience of seeing how things have changed in 14 days in your life, because I know some things have changed too, which are good. And things that are changing in the world, and 14 days can make a difference. So with this experience that you've had with me in 14 Days to Change, and your story, your experiences, and so on, you already mentioned some of the stuff, but maybe you want to add something else. If you could give a message to the people that are going to listen to this, that are going to watch this, regardless if they're South Africans or if they're coming from a country that is better or worse off? Is there anything else? Is there something that you would like them to know?
Yeah, don't lose hope. I think if we're living in a world without hope, then what is there to look forward to? And what the coronavirus has shown me is how people band together. We now all speak the same language. Globally, we speak the language of the coronavirus, and it's not the best language, but it has this effect of uniting people. I mean, Laura, I didn't know you existed until coronavirus, and there are things and places where we can find hope in this time. And so when things get hard, try and find that one beacon of hope that'll get you through it, because we will get through it. And I think most of us will come out of this being better people. And so we're feeling tired, we're feeling it, I get it, I'm there, but just hold on to that hope and keep doing the things that keep you safe and keep your family safe and keep others around you safe. That in itself, knowing that there's one other person out there who is doing everything they can to keep me safe, gives me hope. And so don't lose it.
Don't lose.
We'll make it through it. Don't lose it. Yeah.
It's it's simple, but it's something that the thought is simple, right? But the message is difficult, because when you despair, you don't even think about hope, right?
No. Yeah. So. It as someone who's experienced depression, things that should give you hope don't, and it is so hard to crawl out of that tunnel. And it's easy for me to say, don't lose hope. I'm in a house, I have a roof over my head. But if there is one small thing that you can find in your life that makes you feel like the world will be okay, can be the smallest thing. That's all you need to do. You just need to hold on to that. And hopefully that will be the start of something more and more hopeful. Yeah.
I like it. I like your message. It's
Thank you.
It was needed also.
Laura, don't lose hope.
Yes. Everybody. Carla, don't lose
Everyone.
hope. And and don't stress, because that was your message 14 days ago. Yes, don't stress and keep on doing good for 1 or 100 people.
Yes. Yes.
Do that. And it has been a pleasure getting to know you. I liked our first interview better than our second, not because of us, but because of circumstances.
Yeah.
But I really hope things improve in South Africa.
Thank you.
I really hope that in 14 days, although we won't be having a third interview, I really hope you can write to me and let me know, guess what, this and this happened, and how it has changed for the best. Because we know it does work in a pandemic. It might not work in other sectors of your life or your professional jobs, whatever, but it does work in a pandemic. Yeah. Carla, all the way from South Africa, 14 days to change, your story and South Africa's. Thank you very much.
Thank you so much. This has been great. So glad that I got to meet you.
Ditto. Thank you.
Bye. Bye.